I think the biggest change is really education, and it has to do not only with educating caregivers, but patients as well on what the signs and symptoms are of stroke, so they show up at the hospital in a timely manner and that they can be taken care of. I look at where we are with stroke therapy, similar to how we were with cardiac disease 25, 30 years ago, where they had the educational campaign telling people to call 911 as opposed to trying to drive to the hospital when they're having chest pain. And I think we're in that same area right now with stroke.
There's a shortage of physicians that are trained. There's a shortage of physicians that are trained to perform the procedure. There's also a shortage of physicians, neurologists that are trained to take care of these patients. We can't, as an interventional physicians, we can't really influence that part of it, but we can influence the number of physicians that are trained to actually perform this procedure and to get them more hospitals able to do that.
Well, there are a lot of published guidelines right now for various aspects of stroke care. As far as the technical portion of it, the Society of Interventional Radiology has just recently completed updating the 2009 guidelines, and they are currently under review.
They need to understand the anatomy that they are working in. The brain is very different than any other part of the body. They need to understand the anatomy and the physiology. It's not like a heart where most of it performs the same function, so there's a little bit of safety there if you know, as far as not having, what we call high-value real estate. Everything that you do in a brain makes a difference. So you have to understand that. You have to understand, how to manage these patients. And you have to have the technical skills to be able to work in that very, very sensitive anatomy. And you don't acquire those in a weekend course. That takes a lot of time. And there's no shortcut to it. It really is not a question of specialties. It's a question of training specific to stroke therapy and technical skill. And it shouldn't really be dependent on, for lack of a better word, your pedigree. It should be dependent on, can you do this safely? Can you, meet the requirements to do this safely? And so that there is probably physicians from different backgrounds that can do that. And I think that has to be the final common pathway.
There is data to support this. There are studies from the original studies that were published that really confirmed that thrombectomy was a good procedure with good outcomes. Many of the operators that participated in the original Mr. Clean study were interventional radiologists. At this meeting this year, there was a abstract that was presented in which interventional radiologists were trained over a 6-month period by a neurointerventionalist to perform stroke therapy, and when they compared their outcomes with those of the previously published data, the outcomes were basically the same.